One thing that I tell women all the time is it's so important to make sure you see your healthcare provider on a routine basis. A lot of times women, they're so busy. They're taking care of children or spouses or parents, and they sometimes neglect their own health. One thing that I want to make sure you do is make sure that you get your Pap test screening. We actually start now at the age of 21. Guidelines have changed over the past couple years. And for those women that are healthy, low risk, you can start your Paps at 21. Certainly there's some exclusions, women with HIV or who have kidney or organ transplants because they have immunosuppression. They need Pap screening a little bit differently, but for the most of the population and most of the women that I see every day, starting at 21 is what's recommended. And then once you start Pap screening, you actually only need Paps every 3 years. You don't have to have them every year anymore. Although it's so important to still see your healthcare provider once a year, you don't need to get the Pap test itself every year. Now, what women don't always know is that the Pap test doesn't pick up everything. It's a screening test for cervical cancer. So if you think about getting your mammogram is a test to pick up breast cancer, the Pap test is a test looking for cervical cancer. For women who are 30 years or over, we actually do the Pap test screening and we'll add something called an HPV test. And this is a DNA test. It's very new and it's actually a great way to be able to triage women into low and high risk groups. If your HPV and your Pap test are both normal, you actually can get your Pap every 5 years. And so that's something that women may or may not know. So the Pap test screening isn't every year anymore, but definitely we still want you to see your healthcare provider once a year. And the Pap test screening is to look for cervical cancer. Our rates over the past 30 years have decreased dramatically because we have such great screening guidelines. We just want to make sure that women take time to take care of their own health.